This is the third part of the portfolio project. It is the video, giving a brief discussion about the patient, and also we'll be talking about mainly how the interview went on advanced directive patient wishes. So very quick, this is an 85-year-old patient, Caucasian, past medical history, hypertension, benign prostatic hyperplasia, and Parkinson disease, who was diagnosed about 3 years ago. Family is really aware on patient prognosis. They were well informed at the very beginning. During the interview, the daughter was present, but main part of the history was obtained through the patient, which is still cognitive. There is no impairments cognitive yet from Parkinson. Again, patient is bedridden. He has like weakness, generalized weakness related to Parkinson and also advanced age. But still cognitive and cognition is kept. Patient is alert oriented, is a good historian. Symptoms that were addressed on this visit were mainly related to long-standing benign prostatic hyperplasia and Parkinson, which is advanced. Patient has the classic tremors, is rigid, still maintains good swallowing. The main concern for the visit this time were insomnia and poor appetite, which they were addressed with medications. He was started on Magace, and also he was started on melatonin before starting any other medication like mirtazapine, for example. On this visit, both they agreed on the interview. They didn't resist to any questions. They were really like cooperative the whole time on answering everything regarding the advanced directive. When it came to the 5 wishes, they were really open on what they wanted, mainly the patient, which his goals were stay at home mainly. He didn't want it to be like if and family agreed as well. They have all the what they need. If he continues to like get worse, he will stay at home. The other a family were the main their main goal is always stay together, so they created everything for him in case the condition gets worse, which they are aware that it's gonna get worse. Patient, he on his wishes and also on his post, his DNR, with no use of any mechanical ventilation or any use of artificial feeding. Treatment is going to be just to relieve symptoms, pain, discomfort. He agreed on that. Food, also maintain giving food and liquids as possible. But do not hospitalize or again use any medical intervention to try to save his life. The daughter was present during the whole interview, which was the one he chose to be the power of attorney. She seems a person that, of course, cares about her dad, which is the main goal when choosing a power of attorney, because it's a person that knows the patient and knows what really the patient wants, and that's what she showed during the whole interview. their goals seems like to be established from long time ago, because when I was asking all the questions about who was going to be the proxy, what he wanted for the end of his life, what type of environment, they were really specific, and it seems like they already kind of like had everything planned from before. They are just concerned on how they don't know like how soon or how quick Alzheimer's disease condition is gonna be progressing on him. So during the interview, me and my preceptor, who was also present, gave them a little bit more information about Parkinson's disease, what to expect, mainly the cognition impairment that might eventually come, or which is part of the disease, and as well, one of the main points we addressed during the visit, it was the possibility of developing dysphagia, and avoid aspiration, because that's one of the main issues when a patient is bedridden, has advanced Parkinson, dysphagia start to happen. It's one of the main reasons for some patients who are not DNR and they want to go to the hospital. They do bronchoaspiration, pneumonias. So we did a good teaching about feeding. We spent a good amount of time teaching about feeding, how to like put the patient in an upright position. Eventually, if noted like the minimum caffeine during feeding, notify the primary care, which we're gonna be the ones to like give further instructions on what to do, on how to change the diet, how to change the liquids to thicken. He also, it wasn't there, but he chose as a secondary or person like alternative POA his brother, which is younger than him. It's about 6 years old, and the daughter referred that he's in a good shape, good mentation, so he's going to be the secondary POA. They are a family that they are like economically they are doing well, so they have all the possibilities and the alternative to take care of him at home. He is in a medical bed already, and has a big room with space for everything they need for his care. Patient during the whole interview didn't look depressed or down at any moment. He seems, and the daughter also stated that he had a good life, and he's fully aware and kind of like has an idea how the future, the short future could be. But he's being always really happy person, happy to have his family around. There is a lot of people, and actually this interview took 3 visits actually. During the last 2 visits, there was people, some friends visiting, so he has emotional support from family and from friends as well. We addressed, or we actually took all the complaints or like signs and symptoms new developed he had. We created a plan for him. We're going to be doing continuous evaluation to see how he improved his appetite and his sleep mainly. the hypertension is well controlled, and the MBPH has minor urinary symptoms, but we're going to be also addressing any symptom that might appear. But in general, it was a good case. I liked it because it was a patient that I mainly spent a good amount of time, and I got to know him, got to the family. We created a good rapport. I got to know everything, mainly almost everything about the patient, past history, what he did for life, from the beginning to like his last wishes. So I would say this was a great opportunity to develop that rapport with patients. In general, it was a great assignment.